Satyasnehanam snehasta lavanodganaha. One way of bringing Utklesanam, Satyasnehanam is to bring about Utklesanam with the Lavana snehasta lavanodganaha. Then tadvidyasambhasha ruksham sushmam vyavaicha. So that is Abhishyandi. Lavanam is Abhishyandi. So that Abhishyandi property of Lavanam is used to bring about Utklesanam. So Abhishyandam is a tool, or Abhishyandi nature is a tool to bring Utklesanam. So whether or not Abhishyanda is Utklesana, again in some context it need not be. This is a problem with the Samhita because they Dustapratishaya vajane yachana. They were not very specific about the words to be used. They were all eager to express the meaning. So that is why we need all these samikshas and vichara sadas and all these things. We have to make matters clean and clear. Then another word which we have to consider is vidahi. We will find this vidahi in many contexts, which brings about vidaham. Vidahyanam viruddham cha tattacha asripradushanam bhajadam vidhihinam cha swapnajagaramaipunam. Where is it? Yeah, Vadarakta Vidana. So starts with the Vidahyanam. So what is Vidaha? Is it Abhishyanda? Whether the Vidaham is same as Abhishyandam? Vidaham is primarily a change happening in the Agnisthana. In the Koshta, in the Grahani, specifically sometimes we find that Koshte Gaha. So Vidaha is something closely connected with the Agnisthana in the Grahani, and it is something which is happening in the Annarasa primarily, which will be manifesting with various symptoms in the Koshta level first. But this changes which are happening in the Koshta level, in the Annarasa first, in the level of Agni Karma, will not be confined to the Koshta. Because this is going to spread along with the rasa which is formed there. Pradiroga viti krutha rogadhishthanagamihi rasayanihi prabadhya asu dosha dehe vikrupate. Sarvarogadinana vakhala. Pradiroga viti krutha rogadhishthanagamihi rasa. So the Vidam also travels through the rasa srotas and reaches various destinations, creating various symptoms, of which one can be Netrabhishyanda. One can be Netrabhishyanda. So there, Vidaham is one change which is happening at one location, which is going to be a Nidana for another many sampraptis, of which one is Netrabhishyanda. That is why we find again a very beautifully described portion in the Ashtanga Hridayam Vatmaroga Vijnaniyam. What is that? Sarvaroga Nidanoktai Rahitaihi Upitamalaha Achakshushyairu Visheshena Praya Pittanusarina. Then from that it spreads to the various places through the siras. And the Netravaya Ashrita Siraha. When they reach the Netravaya Ashrita Siras, then Rogan Guryuhu Vatmasanthi Sigam Krishnam Drishtimva Sarvamakshiva. So a change which is happening in the koshta, that can be of different types, of which one is Vilaha type, can travel through the Jatrurdhva Siras via the medium of Rasathavu and can create Abhishyanda in the Sarvodha Jatrurdhasrodasyandanad Syanda Uchyate. Uday Shankar sir highlighted that point very beautifully. Sarvodha Jatrurdhasrodasyandanad. So that Syanda, the word is Syanda. That is manifested in the Sarvodha Jatrurdhasrodasyandanad. So it creates some change in the Srodasas spread all over the Jatrurdha. Again, it is not confined to the Netra. So it happens everywhere in the Jatrurdha. So only that part we are extracting and explaining in Shalakya Mantra. But Sarvarogadinanokkai Rahidaihi Upikamalaha can spread to any place. It can cause Pandu, it can cause Shobham, it can cause Visarpam, it can cause Vagaratnam. That is why we started Vagaratnam Vidakyanam Viruddham cha Bhuktaihi Paryushidaptyushna Ruksha Shushka Vidahibhihi. Where is it? Bhuktaihi Paryushidaptyushna Ruksha Shushka Vidahibhihi. We find similar Vidahi Vidanam in many situations like Visarpam. In Visarpam this happens. In Visarpam this sort of a Vidaham happens. Then what drives this particular change to the Jatrurdhva and then to the Netra? That is very important. Again, while we are trying to bring precision to our prescriptions, these points are going to be important. In Charaka Samhita, we find various nidanas which can cause Rakta Dushti. Sharatkala Swabhavacha Sonikam Sampradishyati. You can display that, no? That Sharatkala Swabhavacha Sonikam Sampradishyati. Sonika Varnaniyam. You will find a long list of nidanas there. Okay, comfortably. This is Charaka Samhita, Sutra Sthanam.
25th Adhyaya, 10th sloka.
If you display, everybody can see. Sorry that I did not give these in advance because these are some sort of a. When we start speaking, all these ideas come, isn't it? So, when we look at those nidanas, we find a big list. And interestingly, they are all highlighted as the nidana which can bring Rakta Dushti. And while explaining this Ashtanga Sangraha portion, Uday Shankar sir quoted that Sarve Kshirodaya Prayo Jayate Syantapurvakaha. A similar line is there in Susruta Samhita. What is that? Prayena Sarve Nayanamayastu Bhavanti Abhishyanda Nimitta Muda. Tasmad Abhishyandam Viryamanam Upajavedashu. But here in Ashtanga Sangraha, he brings a very beautiful twist to that explanation. What is that twist? Sarvekshi yoga yat prayo jayate syanta purvakaha. Next is, this is that, vidhi sonidiyam. Pradushta bahu teekshnoshnayir madhyir annishta tadvidhaihi tadha adilavanaksharayir amlayhi kadubhirevacha kulatthamaasha nishpa. And then Sharatkala Swabhavacha Shonikam Sampratushyati. So this is a very fine, beautiful, elaborate, exhaustive, overwhelming explanation of the Shonika Dushti Nidana. Interestingly, if you look at the description of what is told in Sushruta Samhita as that Ushnabhikattasya Jalapraveshad, you all know that, isn't it? In one textbook called the Chikitsa which is very famous in Kerala, that sloka has some additions. I do not know whether it is originally from Chikitsa or they have taken it, some leads from some other textbooks as well. For those who are interested, I think it is in Malayalam only. So that is why I did not give that quotation, because I know that only very limited people will be knowing Malayalam here. So just before explaining this Ushnabhitaptasya Jalapraveshad and all those things, we will find a few more lines in Chikitsa Manjari. For those who are interested, I will read those lines. I think we have time now. Or whenever you feel like, okay, stop it, we will proceed to the next topic, because these things can be discussed at any time. So, okay. See, the quotation goes like this: Vidahya asaknyadi vigaddhasida Shara amla tikshnoshna guyudravannaihi Tikshnacha gandhad adihasya bhashya krodhad abhisogaihi Pradarekshanacha Madhya anganana abhisevanacha Murthabhikhada ampunimajjanabhyam Avakshiyas kuchridashainoscha Jvaropadavad Riduvaivavikyad Then Ushnabhikaptasya Jalapraveshadi. So what I am trying to say is, if you look at this list of Nidanas and the list of Nidanas which cause Shonika Dushti, you will find many of them overlapping. Many of them overlapping. And many of the suggestions given as the Pathya for Netra Chikitsa as a whole will also overlap in this list. Then this particular twist made by Ashtanga Sangrahakara, what is that? Sarvekshiroga yat prayo jayate syanta purvaka yatascha rektam sandushya. Yatascha rektam sandushya. That is going to be a highlightable line. Yatascha rektam sandushya. So in taking all the Abhishyanda context from different situations together, and when we try to focus this into the Netra Abhishyanda, we will have to understand that it primarily happens, or it takes the Rakta as its Adhisthana, then it happens within the Srotasas. It is fundamentally triggered by some sort of a Vidaha type of a Shonika Dushti Nidana type of Karanas, which is manifesting in the Koshta, in the Abhisthana, and the doshas are becoming asthira in Abhishyanda, and Kapha are the Janaka doshas there. When we take the doshas, Janaka doshas in Abhishyanda, the basic Janaka doshas, then what is art about Vada Abhishyanda? There is a question which we will see later, and I am trying to answer. So these points are very important in all contexts where Abhishyanda is a part of Samprapti, especially in Nayana Abhishyanda. So what I was trying is an extension of what Uday Shankar sir told, and We will see the subtle points regarding the Samprapti and the Chikitsa with our coming discussions. Thank you.
Thank you, sir, for your beautiful explanation of Abhishyanda. So, moving forward, we will have the gross outlooks on different types of Abhishyanda. Now, I will hand over to Dr. Uday Shankar, sir. We can have a gross clinical symptomatologies we can see on different types of Abhishyanda.
Thank you, sir. Thank you for that extraordinary explanation on the pathogenesis or samprapti or the nidanas of Abhishyanda, the wide spectrum of rakta pradoshana karanas by Prasad, sir. Thank you very much. Now we will go into the lakshanas. Before the lakshanas, I want to highlight on the nidana or the what you call etiopathogenesis of Neta Roga. As we have two topics together, we can merge the two together, like Dustapratishaya and Abhishyanda together. So, Sushruta has mentioned 7 important factors for the onset of any disease. What are the 7 factors? Vyadha Utpatti Karanas. There are 7 factors. They are applicable for any disease, any problems of the mankind. We can trace to the 7 important factors. They are Adibala Pravutta, Janmabala Pravutta, Doshabala Pravutta, Sandhata Bala Pravutta, Kala Bala Pravutta, Swabhava Bala Pravutta, and Laiva Bala Pravutta. These 7 causes, all whatever the physiological factors, we can include in these 7 broad categories. The first one is Adibala Pravutta. These are again classified or merged into 3 major entities. What are the 3 entities? Exactly, Adhyatmika, Adhibhautika and Adhidayika. Right. Adhyatmika related with which diseases here? Which sectors here? Adibala Pravutta and Janmabala. And Adhibhautika? Adhibhautika? Sangata Bala Pravutta, Dosha Bala Pravutta. And Adhidayika, Daiva Bala Pravutta, Swabhava Bala Pravutta. Because Swabhava is not under our control, it's from the Daiva Bala. Or Kala Kala is also not under our control. These 2 diseases like Abhishyanda or Pratishaya, they are Adibala Pravutta Vyadis many times. And though it appears that Pratishaya will be ascended and goes into Dustapratishaya, or Abhishyanda is going further into which state Abhishyanda goes to? Adimana and then Atadimana. This progression or Pratishaya to Dustapratishaya, these are all genetically many times they are predetermined. The families are in Adimanta in the family, they are also inheriting these diseases. Or Dustapratishaya, chronic problems, chronic sinusitis or rhinosinusitis or allergies, they are all usually comes in the families. Either because it's genetically or the DNA itself is inherited, or Janmabala Pravutta Vyadis. What are Janmabala Pravutta Vyadis with reference to Abhishyanda and Pratishaya? There are various in Sharirasthana of Sushruta Samhita. We have a list of do's and don'ts, or we should avoid the things if they follow. For example, it is mentioned in Sushruta Sharira that if your craving mother, expectant mother, she takes a specific type of food or wants to eat Maisha Mamsa or take some specific type of food and lifestyle, the child born will be always red eyes, or is also having some squints, or is having certain congenital abnormalities in the nose or in the eyes or in the face or in the texture or in the body skin or his habits. Everything is contributed by the lifestyle of an expectant mother. So Janmabala Pravutta is equally important in the onset of these 2 diseases. Then about the Dosha Bala Pravutta. Again in Dosha Bala we have a long list of Dosha Prakopa Karanas. As sir told earlier, the Pratishaya and Abhishyanda, though they are appear very, very similar because of the Kleda Guna, there is a dominance of Pitta and Rakta in which disease? Abhishyanda? Pratishaya. Which one is dominated by Pitta and Rakta Drishti? Very good, thank you. And in case of Pratishaya, which is more dominant? Vata and Kapha. These two is the major difference, though there is a similarity in most of the other factors. In doshas, doshabala pravutta, we should consider the doshas of Vata and Kapha dominating the entire pathogenesis, entire process of the progression of the disease in Pratishaya, whereas Pitta and Rakta, they are contributing more in case of Abhishyanda. Again, Sandhata Bala Pravutta. What is Sandhata, or how it affects the diseases of Pratishaya or Abhishyanda? Which Adhata produces Abhishyanda? Any idea? Or Pratishaya? Sushruta has mentioned in Marma Adhyayas, different marmas, when there is a Adhigata, or even it's mentioned Shirobhigata, Gatimaituna. Shirobhigata is mentioned specifically in the pathogenesis or Samprapti of Abhishyanda, whereas in Pratishaya we have lot of other complications related to the injuries to the facial Phanamarma Drushti, or in case of Phanamarma Drushti patients, the Phanamarma located in both sides of the nostrils. If at all an injury takes place, there is a risk of developing Dustapratishaya, Adhrana, or loss of sensory perception. So, the Sanghata or the Abhigata is directly responsible for any of these diseases, directly or many times indirectly. Like injured sinuses or blocked osteos, the cilias are controlled by the passage osteo, there is a blockade. Then the disease becomes incurable. It produces all Dustapratishaya symptoms. Similarly, in case of eyes, we have Avarta Marma, Apanga Marma, and Shringataka Marma. These three marmas in Abhigata takes place, patients may end up with Abhishyanda, or Adhimanta, or Hatarimanta. Any consequences can possible with injury to these things. Similarly, we have Kala Bala Pravutta, Swabhava Bala Pravutta, and Daiva Bala Pravutta. How Kala is responsible for Abhishyanda? Kala. In certain seasons, like Shishira Rutu, or Vasanta Rutu, or Varsha Rutu, or Hemanta Rutu, or Grishma Rutu, we have specific types of Abhishyanda, specific types of watery discharge from the eyes. We call it as viral conjunctivitis or viral keratoconjunctivitis. All these things many times are related with the seasons. Similarly, Pratishaya or Dustapratishaya, allergic rhinitis, or allergic manifestation, they are Kala Bala Pravutta Vyadhis. So, management of Kala Bala Pravutta is quite different from management of Dosha Bala Pravutta Vyadhis. So, then about the Daiva Bala Pravutta. What is Daiva? What are the Daiva Bala Pravutta? Yesterday we had long discussions on Daiva Manusha Karyana and all those things. So, Daiva is in first session, that Narayan Prakash sir has told that Charak Samhita, Daiva is not Bhuta or anything like that. Daiva is actually Prajnaparada. Prajnaparada produces the complications which mimics Daiva or Bhuta or Pishat or anything like that. They are not the external factors, they are the internal, mind-related factors, Prajnaparada. Again here, Prajnaparada produces on this Daiva Bala Pravutta Vyadhis. So, Kala Bala Pravutta, Daiva Bala Pravutta, and Swabhava Bala Pravutta. Many diseases are related to the aging, age-related macular degeneration, or age-related atrophy of the brain or the mucous membranes. Age has several complications, or aging has several complications on both eye as well as the nose. So this is in brief about the classification of etiological factors, because classical treatment depends upon the basis of age. Without understanding the disease pathogenesis, rogamado pariksheta tato nantaram aushadam. So roga, the factors influencing the roga, or the factors responsible for the onset and progression of the roga, that is more important in planning the treatment. I will pass on to the dais to Professor M. Prasad sir for further discussion.
Yeah, I think that we cannot spend much time on the same point again and again. We have to move forward. So I think now Uday Shankar sir explained the areas where we have to focus on. while looking for the lakshanas, whether it is, actually every disease should be looked with the understanding what it is, how it is coordinated well within the Roga Bhediyam chapter of Ashtanga Sangraha. There is one chapter called Roga Bhediyam. So that gives a very broad outlook about how a disease should be looked upon from various perspectives, whether it is Nija or Agandu, whether it is Adivara Pravutta type of conditions, whether it is Purvapacharaja or Pratyalpanaja, all these things are to be considered. Couple of things that we have to focus main and seriously is that, see, these days, forget about the classical textual explanations, because they are all explanations considering something like under standard test conditions, or it is something like if everything is ideal, this is going to happen. But unfortunately in life nothing happens ideally. So we have to understand what is practical. See, this Vegarodham is highlighted as one nidana for all these diseases. And all diseases can be caused by Vegarodha. So this, especially this Shadrat Vegarodham, Mutra Vegarodham, Athovada Vegarodham. These three things can create, both these problems can cause Agni Dushti, Pitta Dushti, Vada Pradinodhyam, Achakshushyata. That is one important point that we have to keep in our mind. How a particular cause of that dosha dushti is driven to netra or jatrurdhva, especially netra. It is based on achakshushyata of the nidana. Nidana is one, nidana vishesham is one particular point that we have to look for while treating. It is not just about the nidana, but it is about the nidana vishesha. Nidana Vishesha will give the specific identity to any vikara. Vada over can cause Nathatheda. Vada over can cause Apatantraka. So we cannot say that Nathatheda and Apatantraka are same. But both are Vadika. So the Nidana Vishesha is very important. So, Achakshushyaya Visheshena. So, while looking for the Nidanas, we have to find out where are the Achakshushya factors which are to be corrected, attended with more caution. That is very important. So, Vegarodham can create, see, Shakritaha, Pendigodveshtaha, Pratishyaya, Shirorjaha. So Pratishyayam is there, which we are going to discuss. Even if it is not highlighted, Abhishyanda is also there. Because Sir was saying that Vruddhya Abhishyandanad Padad Koshtam Vayus Chandrahad. That is the way in which the doshas coming back to the Koshta. How do they go? Vyayama dushmanastaikshniyad ahirajaranadavi koshtad chadhasti marmani drutatvan marutasya cha. Without this drutatva of maruta, no dosha will reach any destination. No dosha will reach any destination. So any ahara or vihara or achara or vichara which can cause this sort of or provoke this sort of capacity of vayu to propel other doshas to specific nidanas, sthanas should also be looked for while prescribing. Don't get carried away by the diagnosis that the modern ophthalmologist from London made. Don't commit the same mistake what he did. You have a different understanding of Sharira, that is very important. Then another crucial point is, we say, that is one important funny thing that I notice in the text, Prayana Sarve Nayanavayastu Bhavanti Abhishyanda Nimitta Mula. how to explain this, how to understand this. Nimitta is Mula, Mula is Nimitta. So Nimitta Mula means, what is the meaning of that? Bhavanti Abhishyanda Nimitta Mula. Nimitta is Karana, Mula is Karana. So Bhavanti Abhishyanda Nimitta Mula means, how to understand it? See, Abhishyanda Nimittaha, Abhishyanda Mulaha cha. Prayana Sarve Nayanavayaha, Abhishyanda Nimittaha, Abhishyanda Mulaha cha. So in the first Nimitta, that shows the Nimitta Karana, the Nidana Arthakaratva of Abhishyanda as far as all other diseases are concerned. The Mula means it is a Upadana Karana of all Netra Rogas. That means the presence as an ingredient of Abhishyanda is there in all Netra Rogas. So Abhishyanda is a Nidana Arthakara Bhava for all Netra Rogas, and Nidana Abhishyanda is an inevitable ingredient in the manifestation of all Netra Vikaras. That is why Sushruta specifies it as Nimitta Mula. That is also so. While collecting the Lakshanas, we should try to collect the entire presentation, then only we will understand what to do next or how to understand it. Then coming to the Chikitsa, when we put all these points together, see, Saeva Upido Doshaha Samuthana Visheshataha Sthanantarani cha Prapiviganan Gurute Guhun Saeva Upidaha Doshaha. So sometimes it can be Abhishyanda, sometimes it can be Pratishaya, sometimes it can be Arbuda or something else. Saeva Upido Doshaha. How? Samuthana Visheshataha, Nidana Visheshataha. Then Sthanantarani Prapya. How to Prapya, Prapana of Sthanantara, Samuthana Visheshataha. Vikaran Kurude Bahun, Tasmad Vikara Prakriti. That is where this completeness and exactness of information production is becoming crucial. Don't get carried away by the first, most preferred Lakshana is extracted, finished. Don't do that. Or don't look at the medicines you are stocked in the clinic and then come to the diagnosis. Don't do like that. Vikara Prakriti. Vikara Prakriti accommodates all these things in its completeness and exactness. These are two words which are to be there in our minds in golden letters. Exactness and completeness of information. Tasmad Vigara Prakriti Adhishthanandarani cha. Adhishthanandaram, here it is Chakshus. So even if you are doing a Kaphavitta Samana Chikitsa, Rakta Prasadana Chikitsa, it should be Sthana Visheshena Bheshana Visheshaha. Any Rakta Prasadana Dravya need not be suitable for eye. It should have some sort of a Chakshusya property as well. That is why even though we have many Kledahara Aushadas, Trivada is becoming Akshyameshu Sreshtaha. So, Tasmad Vigara Prakriti Adhishthanandarani cha. Adhishthanandaram Sthana Visheshena Bheshana Visheshaha Buddhva Hedu Visheshamscha. Not Hedu, but Hedu Vishesham. So, focus on Hedu Vishesha. For a problem which is manifested by Vegarodha, you need not manipulate many things in the Sthana Vishesha. Hedu Vishesha is Vegarodha. So first you have to focus on Anulomana. Anulomana. Then only see if Apana is Viguna and do not identify that, and you identify a very severe Vada Vyadhi in Netra, Vada Abhishyanda in Netra, mind it, you will never succeed in controlling that Vayu in the Netra. I am not saying that you may not succeed, you will never succeed in controlling that Vayu in the Netra as long as the Vayu in the Apanasthana is not brought to Anulomana. Never. So, understand the whole mechanism, not your speciality. I am a Saladhi, I am not supposed to look at the Apanasthana. My sthana is Pranasthana. Don't get carried away by these sort of preoccupations. These are all for administrative purposes NCIM has brought in, not for clinicians. You have to find the God. So wherever there is Prathamika, Prathama, first primary source of the Samprapti, that should be corrected first. That should be corrected first. Then consider the Sthana Vishesha and consider all other beautiful explanations compiled by Vakbhada from various sources in his extraordinarily beautiful chapter called the Bheshadavasaniya. Extraordinarily beautiful text called the Bheshadavasaniya. Each and every point, how to consider them and converse them to make one of the best prescriptions that a Vaidya can make. So, we have to consider that Vektadushti, we have to consider the Tikshna Ushna Gunas of the Pitta, in the Agnisthana, the shield that is created by Kapha to protect the potential risk of Pitta getting rude and raw, killing or destroying all other Sneha Bhavas, creating Vidaha first in the Koshta and then all over the body. Look for associated symptoms. When we are focusing on an Abhishyanda in the Netra, don't overlook a Sita Pitta that the patient is complaining recurrently, or a Hridaha, or a Gudalaha, or Arshas. Tasu Abhishyanda Murtishu Jayandir Shamsi. There is Abhishyanda in the Budavali, in Arshas. When there is Abhishyanda in the Budavali, Tasu Abhishyanda Murtishu Jayandir Shamsi, it can reflect in the Netra also. So don't overlook Lakshanas in the other sthanas. Then try to understand the guna in their Amsha Gana Vikalpa and come with the precise interventions. Tatralpe Lanthanam Patil, Madhye Lanthana Pajanam, Prabhude Shopanam. And in Vada Abhishyanda specifically, considering the complete or overall involvement of Rakta and Pitta associated by Kapha, while understanding your Vada Abhishyanda, you should always keep the possibility of Vada Shodhya in your mind. Vada Shodhya Samprapti, as you learn it in Kaya Chikitsa, shall be translated to a great extent in the management of Vada Abhishyanda Chikitsa. By all means. So, without learning Vada Shodhya Chikitsa properly, even though you are a Shanaki, you will not be able to manage Vada Abhishyanda properly. So it is a total program. Agni is taken care of, Ojas is taken care of, the sthana of Vayus and the status of Vayus are taken care of. Sthana Vishesha is taken care of, Ahara is taken care of, Vihara is taken care of. Aushadhanda Viharanam Upayogam Subhavaham. Don't get over inclined towards Aushadha alone. Aushadhanna viharanam. Aushadham annam viharam. Yathottara galottaraha. So viharam is going to be of the topmost priority. Aharam comes next. Aushadham last. If the viharam and aharam taken care of, Aushadham is minimal. Otherwise, you will be loading the system with the Aushadhas and the results will not sustain. So, Abhishyanda is a state, Abhishyanda is a process, Abhishyanda is a potency, Abhishyanda is a manifestation, Abhishyanda is a vikara. But they are all interconnected, but with the little differences context-wise. So try to understand what provokes Abhishyanda, whether it is Vidaha, whether it is Abhyayama, whether it is Adhivyayama, whether it is Jagarana, whether it is Adhinidra, whether it is Akala Sirasnana, whether it is Akala Abhyanga. Many things which you all know. And start from that point. Even though it is a huge textbook, Sushruta thought of highlighting one point in the beginning of Netra Chikitsa. What is that? Samshayavada Kriya Yogo Nidana Parivartana. He waited until that. He never highlighted even the entire textbook. He waited to the Uttarasthana, Netra come. Then highlighted Samshayavada Kriya Yogo Nidana Parivartana, which talks in volume as far as Shalakya is concerned. Thank you.
Thank you very much, sir, for the beautiful narration of Abhishyanda. So actually what sir told, Abhishyanda and Pratishaya we cannot categorize. Now I am feeling it would have been much better if we would have not categorized our departments itself. Like Chalakya. So now moving forward to the next disease, Pratishaya. As Dustapratishaya is the main core of subject, but we'll highlight Pratishaya first and then we'll go on with the discussion of Dustapratishaya. As Acharya Shushruta is telling in his Uttara Tantra 24th chapter, Sarva eva Pratishaya narasya pratikariнаha kalena rogajanana jayante dustapinasaha. The same concept what sir has already explained in Abhishyanda, we'll move forward with Pratishaya. I now hand over to Dr. Uday Shankar sir.
Thank you. There are two important aspects which Prasad sir has asked us to concentrate. The one is the Chakshushya and Achakshushya. And second one is the totality of the disease, like doshas. Actually, the movement of the dosha gatis are doshas and the combination of the dosha, prakopa karanas and Achakshushya sevana that produces different types of Abhishyanda. Almost similarly, in Pratishaya, the local factors or the nose-related factors and dosha involvement that they are important. And in significance of Pratishaya, why Pratishaya is considered as the main disease of Shiro Pradesha, because Pratishaya can end up with any disease. The cause of all other Nasa rogas and cause of all other Netra rogas, cause of all other Karna rogas, cause of other Netra rogas or Shiro roga, Karna roga or Gala roga, Kantha roga, everything is related to the Pratishaya. If you see the list of clinical features mentioned in all classes, you will be finding almost all diseases of Shalakya and the Pratishaya itself. Then second one is Vardhamanam Kshayapradam. Suppose Pratishaya is not attended properly, there are Upadravas or Udarka or Pratishaya related to Kasa, Sanjayate, Kshaya. So it's a progressive disorder. Though it begins as a just on the spot or Satya Pratishaya Karana, if you not attend it properly, as sir told, Sanchepata Kriya Yogo Nidana Parivartanam, that Nidana Parivartana is not done properly, definitely the disease is going to move into Kshaya Pradam, Vartaman, Kshaya Pradam. Kshayaprada leads to tissue damage. Most of the tissues of various sinuses, or it may be tissues of the oral mucosa, or tissues of the brain or meninges, everything will be going to be damaged if pratishyaya is not attended properly. Third one is, it also leads to yakshma. Yakshma is rogarat, or it's the king of all diseases. And Raja Yakshma can produce changes in our bones, changes in our system, changes in the nerves, changes in the skin, changes in the, everywhere you will be finding changes because of Raja Yakshma. Pratishyaya is the cause for Raja Yakshma. Even before the Purva Rupa itself, you can predict Pratishyaya. Let's see, you will see the next this one. Then what is Pratishyaya? Like Abhishyanda, we have some etymological derivations or specific definitions. Pratikshanam, prati stands for pratikshanam, sravate, pratikshanam syayate. That is called as one definition. Another one is prati abhimukam, opposite to the movement. Abhimukam, shayogamanam, kafadinam yatrasaha, pratishyaya. So basic pathology in pratishyaya is vatavritti, like Sir told, Vega Vidarana, or different types of factors that increases Vata Prakopa. That is the basic factor, and that produces Kavaidina is there in the nasal region or in the Pranava, so that the patient is going to have Kafadina. Charaksamita as further mentioned, Shleshma Rudiram Piddameva Marutatma Tashirasa Shayate Marutam Prati. Along with the movement of Maruta, the Viguna Vata takes away Shleshma Rudiram Piddameva. Grana mule, in the base of the grana or the nasal roots or the beginning of the nose, we have the pathology of vayu or prakupita vayu. So this is the continuous secretion of mucus or inflammatory exudates that flow in conjunction with or against the respiratory movement. There are two factors here: pittam, shleshma, rudiram. All the three factors, but shleshma is the main factor. Continuous secretion of mucus. There will be changes in the mucous membrane, there will be changes in the ciliary actions. So that is related with the kapha. And then, where the airflow dynamics are regulated by neurological and autonomic systems, these things will also be damaged because of viguna maruta. Next slide. So you can see the process of pratishyaya. Kashyap Samhita has devoted a separate chapter. Most of us are unaware of Kashyapa's contribution for the knowledge of Pratishyaya. Kashyap Samhita in Chikitsa of chapter number 12, he has devoted an entire chapter for the understanding of Pratishyaya. Pratishyaya has mentioned, it is a process. It says, Vidanaiki Mandagme Vishamashina. The basic factor is Mandagme and Vishamashina. Person having already Mandagme and takes Vishamashina. Vishamashina is Viruddhashana or Vishamabodhana. Then, Vata Prakupita. Urdhva Kafashayam Pradushya. What is Urdhva Kafashaya? Urdhva Kafashayam Pradushya. Kafashaya and Urdhva Kafashaya. Shiro is considered as Urdhva Kafashaya and Urosthana is considered as Kafashaya. Amashaya is the Kafashaya. So Urdhva Kafashayam Pradushya, entire Kafashaya, entire Shiras is affected. Then Shrotamsi Pratishyayati. He has used this as a Kriyapara. Shrotamsi Pratishyayati. Pratishyaya is not Namapada, it's a Kriyapara. Kriyapara is the verb. You can see Shrotamsi Pratishyayati. Entire Urdhva Kafashaya Shrotas. Whatever may be the Shrotas. There are Pranava Shrotas, there are Udakava Shrotas, there are Rupava Shrotas, Gandhava Shrotas. All these Shrotas are becoming Pratishyayati. The word Pratishyaya stands for Viguna Vata in all these places. Because Vata is the Pravakta, Cheshtanam Pravakta. All the Cheshtas, all the movements in the Shrotas is dominated by Vayu. And that particular function is disturbed and Pratishyayati. Entire Shrotas becomes deranged movement of Vata. That is the basic pathology. Next is Sayada Mukhasrotamsi Bhushayati. When that particular Pratishyayana takes place in the Mukhasrotas, then Tada Mukharoga Hajayante. Then there will be all types of oral ulcers, oral diseases, many types of, we have different broad list of Mukharogas like Oshtaroga, Jikwa Roga, Dantamulagata roga, Dantaroga, Galaroga, and various types of Kantaroga, Sarvagata rogas. All those things are produced when Srotamsi Pratishaya. This is the basic theology. Similarly, Yada Shrotram, Tada Karna roga. When it affects ear, we have all types of Badirya, Karnananda, Karnashula, various types of Karnasha, Karnavidya. Everything is possible when Srotamsi Pratishaya. Last one he says, Yada Nasika Mulam Prati, Kafam Pittam Asribhuva Shyayati. When the Vayu takes the Rudira, Kapha and Pitta into the Nasika Mula, then Tada Pratishaya iti uchyate. Then it is called as Pratishaya. So just like Abhishyanda, Pratishaya is also a process. Pratishaya is a process that produces different manifestations with different organs, as told, different sthanantaram, different types of samsthana and sthana, that the manifestations are different. Next. Nidanam Dvidam. As all of us are well, we have two types of nidhanas. One is Satyojanaka Nidhana and another one is Chaya Vikrama Jata Nidhana. Like Chaya Prakopa Prashama, Chaya Sanjayanta Prakopancha Prasaram Sthana Samshayam Yakta Vedan Chayovi. This is the normal course of this. But we can overlap all the earlier four stages: Sanjaya, Prasara, Sanjaya, Prakopa, Prasara, and then Vyakta. Instead, we can directly go to the Vyakta Avastha or Veda Avastha sometimes because of Satyojanaka Nidhanas. These are all the Satyojanaka Nidhanas. Here again, most important, Shirobhitapa, or whenever there is an injury to the head or disease, Abhitapa of the head because of the various factors, Shiros Obhitapa, or external allergens like Dhumo, Rajaha, Atikratapaha, Shita, these are all the external triggers. Sandharanam Putra Purishayoscha, sir has highlighted that point. Vega Vidharana. Vega Varoga can produce Abhishyanda. Vega Varoga can also produce Pratishaya. So both are related with the Vega. Sandharanam Putra Purishayoscha. Satya Pratishaya Nidhanam. That can be Satyojanaka Nidhanam or it can be Kalantara. It can act in two ways. Double acting of this particular factor. Shiro Abhitapyate as a Shiro Abhitapa. Next slide. These are all the regular factors. Again, there is most of these things are related with the Vata Vritya, Vata Prakopa factor. Sandharana, Jina, Prajoti Bhashya, Krodhat, Vaishami, Shirobhitapi, Prajavara, Atiswapna, Ambu, Shitehi, Avashyaya, Maituna Bhashpadhumai. This is from Charak Samhita. He says this particular word. Samsthyana doshe shirasit pravruddho, Vayu, Pratishaya, Udirayoto. That is samsthana doshe, particular place where these doshas are accumulating and producing the symptom. That is more important because in Pratishaya there is a long list of all nature rogas. Because of this different types of manifestations, because of the samsthana dosha. This is further explained in commentary. Samsthana doshe shirasi Ghanibhuta Shleshmani Shirasi. In the Shiras, whenever there is a Ghanibhuta Shleshma, that is responsible for the different manifestations of Pratishaya. Yes. This is like the same thing. Chayadikramena, this is Madhukoshastamenti. Chayadikramena Utpannasya Dosho Gariyam. Chayadikrama Dosha Samprapti is very, very chronic. It can produce long complications or severe complications, whereas Satyojanaka that produces immediate symptoms, but it can also regress or cure immediately many times. Sakala Sharira Sambhavanaya Baddha Mulatva. It has Baddha Mulatva, so it is very long lasting. Many times we overlook in our Abhimana of Ashtanga Hridaya, we are more accustomed to reading Ashtanga Hridaya and Ashtanga Salika. We many times forget what other samhitas like Belabhya, Tunnavatyanti, Tasmat Grashim Subhashtam, we say that. Veda Samhita and Harita Samhita has also contributed greatly towards the knowledge of Pratishaya. You can just look at the Veda Samhitas like that references. Asatyam Gandhamadaya Vatoya Yadati Vijyate Tatra Madhyesha Samani Pratishaya Pravartate. So, Veda Samhita's basic understanding of Pratishaya is because Asatmya Gandha is the basic factor. Different types of Gandhas, and they are mentioned in Sushruta Samhita's Gandha Pranasrava, Vijnana, various types of Gandha. And any abnormal Gandha that can produce the Pratishaya according to Veda Samhita. He has further mentioned, as I told right now, the Apana Vaigunya relation with the Pratishaya, or Apana Vaigunya relation with the Abhishyanda. Veda Samhita has highlighted that point once again. Gadham Purisham Gratitam Shushtam Vada Samiritan. Whenever the person has constipation or Gadha Purisham, he ends up with Badhiryam, Timiram Chapi, Pratishaya Matapijan. Is there three major complications can occur in the head and neck region because of the constipation. They are Badhiryam, he can lose his hearing, he can lose his eyesight, he can lose his sense of smell and Pratishaya. These three are the complications of Gadha Purishya and Veda Samhita. In Haritha Samhita you can see three major classifications of Pratishaya. Next slide. From Haritha Samhita you can see the classification of Pratishaya, three major categories. One is the Nasarogo Bhavyat Jiman. Here the word Nasaroga stands for Pratishaya because here Haritha Samhita has not discriminated Pratishaya from other diseases. He says Nasaroga as Pratishaya. Nasarogo Bhavyat Jiman. Krimi Dosha. The first factor in the onset and the progression of Pratishaya is a krimi. He has given high importance for the krimis in the manifestation of Pratishaya. Of course, there are many Karanas like dosha, Dosha Jahapuna, Raktadaschapi, Vishat Shreshta, Lakshanam, Shunushwamine. Haritha Samhita has given prime importance to the krimi and related with the Dosha Dushti and Rakta Dushti. These three factors we should consider whenever there is a patient of Pratishaya. We should eliminate the like in Dustapratishaya, Krimi, Sambhota Dustapratishaya, you have mentioned in other classical texts, but where Haritha Samhita has recognized it as the first factor, Krimi, Dosha and Rakta Dushti. These three dimensions, every patient we should consider. Next slide. These are all the predisposing factors because Pratishaya is related with several other diseases. Even in Kapha Prameha, Pratishaya is one of the symptoms. Even in Apasmara, Pratishaya is one of the symptoms. You can see the list of diseases where Pratishaya may be a Purvarupa, Pratishaya may be Upadrava, or Pratishaya may be Lakshana itself. As you are well aware in Ekadashrupi, Rajayakshma Pratishaya is a type of Ekadashrupi, one among the 11 types of Rajayakshma. Shleshmika Jwara, Pratishaya is a symptom. Like Udavarta, Pratishaya is a symptom. You need not treat about the Pratishaya then, you have to treat Udavarta. Similarly, Kafade Gurma, Pratishaya is a symptom. You can see in Charak Nidana, 4th, 11th sloka. Similarly, in Rajayakshma, Arshas, as sir rightly pointed out now, relation of the Arshas with Abhishyanda, relation of Arshas with Pratishaya again. Sahaja Arsha Karanas, Pratishaya is one of the Karanas for Sahaja Arsha. Then Kafaja Prameha and some Apasmara. These are all the predisposing factors or associated symptoms in Pratishaya. Next. Next about the Samprapti of Pratishaya and its clinical manifestation. Finally, the treatment. We will move on to Prasad's expert opinions on the manifestations of Pratishaya. Thank you.
Thank you very much, sir, for highlighting especially the concepts given by Bhela, Haritha and Kashyapa Samhita. Now I hand over to Dr. Prasad, sir. I request Dr. Prasad, sir, to highlight Vapata Nidana on Pratishaya, Avashyaya Nidana, because it is clinically more we can talk on that. So please.
So thank you, Uday Shankar sir, for a very elaborate and very beautiful explanation about the Pratishaya as a whole. But I think we have to come to Dustapratishaya. Dustapratishaya is our topic. So regarding the Nidana, see that division that Satya Pratishaya Nidanas and which bypasses the Chaya, Sanchayanja, Prakopanja, Prasaram, Sthana, Samshrayam, that sort of a sequence and the other type. So it is something like a Achaya Purvaka Kopam is happening. And the classical one where this sequence is maintained. So that is very important as far as simple Pratishyayam is concerned. See, Pratishyayam is a Rogam and is also a Lakshana. So, Pratishyayam as a Lakshana we find in many situations where it is a Paratantra Vikara, not a Swatantra Vikara. And in those cases, I think the Swatantra Nidana will be another Vyabhi. We find the explanation in two situations. One is in Raja Yakshma, then second is in Nasaroga Vijnana. In Raja Yakshma, we find the Chikitsa of Penasam and all this. And we, as sir told, Penasam is one among the Ekadasha Rupas of Raja Yakshma. But there, Penasam is a Paratantra.